Good morning and good afternoon, and welcome to the Social Protection in Child Marriage Evidence, Practice, and Opportunities webinar. I'm your moderator, Tia Palermo, and I'd like to welcome the audience. This is the 25th webinar of the Social Protection Responses to COVID-19 webinar series. The series is a joint effort initiated by the IPCIG, GIZ, on behalf of the German Federal Ministry for Economic Cooperation and Development, BMZ, and the Australian Government Department of Foreign Affairs and Trade, DFAT, in collaboration with the socialprotection.org platform and the cooperation with partners from different organizations. The webinar series is a part of an initiative with two other major components: a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter, and an online community on the topic to systematize information and foster discussion. Join the online community Social Protection Responses to COVID-19 Task Force to learn more about the whole initiative, find out how to collaborate, and keep updated about future webinars. This is also one of the sessions organized by the SPIOC-B Gender Working Group as part of the larger Social Protection Responses to COVID-19 webinar series. You can join the Gender Responsive Social Protection online community if you're interested in learning about the gender impacts of COVID-19. The next webinar of the Social Protection Responses to COVID-19 series will take place on August 11th and will focus on how countries are developing shock-responsive financial planning to build resilience against future shocks through disaster risk finance and insurance programs. Don't forget to register. Links will be posted on the chat box. Next slide, please. And next slide, please. In the current webinar, we're going to have 10 minutes of opening remarks, followed by 3 presentations lasting 15 minutes each. Then we'll have 30 minutes of Q&A after all of the presenters have presented, followed by 5 minutes of closing remarks. Next slide, please. I'm your moderator, and I'm going to go through the bios of all of our participants before I give some overview remarks about the webinar. So I'm an associate professor of epidemiology and environmental health at the University at Buffalo State University of New York. My research examines impacts of social protection on general well-being and population health. Prior to joining University at Buffalo, I was a social policy manager for social protection at UNICEF, where I led research looking at social policy, poverty, and health with a focus on children and adolescents. I now have the pleasure of introducing our speaker bios. Next slide, please. Nicola Jones is the director of the Gender and Adolescence Global Evidence GAGE program and a principal research fellow at ODI. GAGE is a longitudinal research program funded by DFID following a cohort of 20,000 adolescents in the Global South across the course of adolescence and into young adulthood. Nicola's research work focuses on gender, adolescence, and social policy and social protection. She's the co-author with Rebecca Holmes of Gender and Social Protection in the Developing World, Beyond Mothers and Social Safety Nets. She has a PhD from the University of North Carolina at Chapel Hill in political science. Next slide, please. Nankali Maqsood is the senior advisor focusing on prevention of harmful practices for UNICEF Program Division. She has over 15 years of experience in managing child protection programs in Eastern and Southern Africa with UNICEF. Nankali has played a leading role in coordinating UNICEF's engagement with governments and other partners in the development of programs for the protection and care of vulnerable children in countries in Eastern and Southern Africa. Next slide, please. Rachel Yates is the Director of Learning and Regional Implementation at Girls Not Brides, the global partnership to end child marriage. Girls Not Brides are working with over 1,400 member organizations to support evidence-based advocacy and programming as part of the community, national, and global efforts to address child marriage. Rachel's career to date has focused on child protection, gender inequality, and social inclusion. She was previously a senior social development advisor at DFID, and she holds a PhD in anthropology from University of Sussex. Next slide, please. Before we begin, I want to clarify that a Q&A session will happen at the end of the webinar. We encourage you as audience members to send your questions to the panelists throughout the webinar. We'll make our best effort to address all the questions during the Q&A. However, if we're not able to, we'll prepare a Q&A written document, which will be shared with the audience and available on socialprotection.org some days after the webinar. By joining the Social Protection Responses to COVID-19 Task Force online community, you can also participate in the follow-up discussions about the webinar. Next slide, please. Next slide, please. Child marriage has multiple drivers, including poverty and social norms. Because poverty is such an important driver, there's been increasing attention to the role that social protection might play in reducing child marriage. Social protection programs rarely include objectives around child marriage reduction, but we've seen from a broader evidence base that social protection programming, including cash transfers, can often have protective impacts beyond their primary objectives. Among these broader impacts, there's growing evidence that cash transfers have led to improvements in adolescent and youth mental health, reduction in violence against children, reductions in intimate partner violence, and more. These positive improvements in health and well-being work through pathways such as increased economic and food security, reduced stress, changes in time use, and more. Next slide, please. There are several pathways through which COVID-19 may exacerbate child marriage risks. The first is the poverty pathway. COVID-19 is exacerbating poverty and economic insecurity around the world. Resulting food insecurity and pressures on securing basic needs may serve as a push factor for households to marry off adolescents. In this way, they may relieve the economic burden of providing for an additional household member, but at the same time, in some contexts, they may also receive a bride price, which further alleviates economic security. The second pathway is schooling. Disruptions to schooling can make it hard for adolescents to return to school even when school reopens. Extended periods between learning can make passing exams to get to the next level challenging. Adolescents may start working in the meantime, and households may need to maintain their income. And then when schools reopen, even if households want their adolescents to return to school, economic insecurity exacerbated by COVID may make it challenging for households to pay school fees, books, uniforms, etc. Evidence shows that schooling is protective against child marriage and pregnancy. However, the direction of this relationship is often complex. The SRH pathway, so sexual and reproductive health, given what we've seen so far during the COVID-19 epidemic, as well as the evidence from previous epidemics such as Ebola in West Africa, it's possible that COVID-19 may increase both child marriage and adolescent pregnancy, which again further exacerbates child marriage. COVID-19 has affected sexual and reproductive health service provision through decreased supply of contraceptives, but also it may affect staffing and provision of services and facilities, as happened with the Ebola outbreak. During that outbreak, adolescent pregnancy increased, driven by school dropout, boys working instead of going to school, and in turn having more money to engage girls in transactional sex, increases in gender-based violence, and restricted supply and access to reproductive health services. All of these may lead to an increase in unintended pregnancies, which in turn increase early marriage. Next slide, please. The pathways through which social protection, both generally and in the face of COVID-19, may reduce child marriage include improved economic security and reduced food insecurity, relaxing of budget constraints, and increased investments in education. Subsequently, increased productivity related to farming and livestock of households may lead to an increased demand for child or adolescent labor. Evidence for this has been found in settings such as Ethiopia, Zambia, Malawi, and Tanzania. In some ways, this may be protective as children are switching from engaging in casual labor outside the household to work within the household. This may also induce households to keep adolescent girls in the household and not marry them off, as evidence from Ethiopia's PSNP suggested. Increased economic security may also lead to reductions in stress and improved mental health of household members. These may lead to greater hopefulness and rise in aspirations, both among children and parents. Combined with economic security and greater ability to plan for the future, this may lead families to having more perceived choices with regards to child marriage. At the same time, adolescents' ability or agency to express their own preferences regarding marriage may improve, including the ability to refuse or postpone marriage proposals via increased self-esteem and also empowerment channels. In the long term, which we don't yet have evidence for, it's possible that increases in schooling attainment resulting from social protection programs may lead to increases in gender equitable attitudes and subsequently delays in marriage in the next generation. Next slide, please. This slide provides a cursory summary of the evidence to date on cash transfers and child marriage. None of these come from emergency settings, so our ability to draw conclusions from this evidence to how COVID and COVID-related social protection responses will mitigate child marriage is limited. However, it does show how variable the evidence on whether cash transfers can reduce child marriage is. In the upper left quadrant, this indicates evidence from cash transfer programs which led to reductions in child marriage. One is the Ethiopian government's Productive Safety Net program, the PSNP, and the other is a non-governmental program in Zombo, Malawi. It's interesting to note that neither of these were conditional on school attendance or other adolescent-related behaviors. In the upper right, we see that to date, no program has been found to increase child marriage. In the lower left quadrant, we see a governmental program in India had mixed findings. A one-time lump sum transfer conditional on not marrying off adolescent girls led to a reduction in child marriage, but then an increase upon turning 18, as households may have misinterpreted the payment as a way to help support the payment of dowries. Finally, in the lower right quadrant, we see that several large-scale government cash transfer programs, ranging from those in Zambia, Malawi, Tanzania, Mexico, and Cambodia, in fact had no impacts on child marriage outcomes. Thus, in some settings, cash transfers alone are unlikely to reduce child marriage, and more integrated social protection measures combined with complementary programming and linkages to other services are likely needed. Next slide, please. We're going to hear from the panelists today on the potential for social protection to reduce child marriage. To respond to the economic security that the COVID-19 pandemic is creating, 200 countries have adapted or created 1,055 social protection measures to respond to COVID-19. However, it seems that social protection as a tool to reduce the risk of child marriage is currently not on the radar of policymakers. In a summary of objectives and program characteristics from Gentilini and colleagues' July 10th version of their paper summarizing government social protection responses globally to the pandemic, there's no mention of marriage in any of the programs. Relatedly, if we do a search for adolescents, we find only 2 programs across 2 countries specifically target adolescents or households with adolescents in them. One is school feeding in Chile, and the other is adolescent girls empowerment in Uganda. Thus, the risk of COVID-19 induced economic insecurity leading to increases in child marriage does not currently seem to be a priority in program design. Such gender-blind programming may end up exacerbating gender inequalities. Nevertheless, we know from the broader social protection evidence base that programs may still mitigate this risk without child marriage specifically being highlighted in program objectives. As you listen to our panelists today, there's 3 main points I'd like us to keep in mind as we discuss the potential for social protection to reduce child marriage. The first is, what are the primary drivers of child marriage in a specific context, and how much of this is being alleviated by COVID-19 related social protection responses? Social protection in normal times can allow families to invest in human capital development such as health and schooling, as well as in productive assets that reap longer term benefits. In the face of COVID-19, families may be struggling to adjust to rapid, unexpected decreases in their income, and social protection responses may only partially meet these needs. Thus, expectations of broader impacts beyond food security and meeting basic needs may be unrealistic. On the other hand, these are a push factor for early marriage, and to the extent that social protection responses help households meet these needs, they may be able to mitigate against increases in child marriage, which occur as a negative coping strategy. The second is, are we comparing apples to apples? So when we draw evidence from the existing evidence base, how might program characteristics vary? So this includes transfer size, transfer frequency, the population which is being targeted, and soft messages, and how do these vary between programs? Finally, assuming that integrated social protection is an objective, what is the existing capacity of the systems that you aim to link, including social protection and other systems? Can these be linked without overburdening one or the other system? And if not, what steps must be taken prior to envisioning the linkages? Now I'd like to turn it over to our first panelist, Nicola Jones.
Thanks very much, Tia. Good morning and good afternoon, everybody. So next slide, please. So what I'd like to do in my presentation is to provide you with a very brief overview of the Gender and Adolescence Global Evidence Research Program, which provides the data that underpins my discussion, and then turn to the following questions. So how has COVID-19 and the government's responses impacted child marriage and married girls' well-being? What measures are effective at reducing child marriage and supporting married girls, and what role can social protection play in this? And then finally, what do our findings suggest in terms of how social protection should be readjusted to address COVID-related risks and protect adolescents from and in child marriage? Next slide, please. Next slide, please. So by way of introduction, the GAGE program is a longitudinal research initiative which is exploring adolescent girls and boys' capabilities and what program interventions can best support their developmental trajectories across the pivotal second decade of life from 10 to 19 years. Next slide, please. So GAGE is the largest longitudinal research initiative in the Global South. We're following 20,000 young people over a 9-year period, and we're mixing quantitative research, including a sample at baseline of 1,000 girls and boys who were either married or divorced. And then we're complementing that with qualitative and participatory research to get at particularly some of the more thorny gender norms questions. Next slide, please. So like many research programs, we have pivoted to undertake virtual data collection since the onset of the COVID pandemic. And we have undertaken individual interviews, small group discussions by phone and by internet platforms, but also worked with young people using digital storytelling and audio diaries to understand their experiences during the COVID pandemic and the types of risks and challenges that they're facing. So in the Middle East, in Bangladesh, and in Ethiopia. And part of that work has also included a survey with 10,000 young people, and the findings from that will be coming out in the next month. But today I'm going to focus primarily on our findings from the rapid qualitative and participatory research so far, including a brief that we've just launched today looking at child marriage risks in Ethiopia in the context of the pandemic. Next slide, please. So one thing just to highlight, the 3 examples that I'm going to spend most time referring to in my presentation are not only very diverse contexts, but they've also had varied government responses to COVID-19. So this varies from Jordan, where there was a very strict lockdown early on, and now there's been a gradual return to normality with a very low caseload still, contrasting with Ethiopia, where there's been a reasonable amount of attention and social distancing and hygiene measures in urban settings, but relative neglect in rural areas. And then in Lebanon, it's really been compounding economic and political crises that were already very prevalent prior to the onset of the pandemic. Next slide, please. So the first question, how has COVID-19 and government's policy responses impacted the lives of child marriage and married girls? So I think what really comes up very strongly in our findings, and you can see more of this online, is the very severe psycho-emotional toll that the pandemic has had on many vulnerable adolescents. And next slide, please. A lot of this is related to fears about the impacts on young people with the closure of schools and the economic downturn. What we are finding, though, so far in the immediate period following the lockdowns in April through to June, when our research was undertaken, was that in Jordan and Lebanon, we've actually seen that the pandemic in the short term has reduced child marriage for now, because stay-at-home orders decreased access to employment, have reduced household income, and really rendered marriage festivities too expensive. And many girls talked about the fact that they didn't want to miss out on the excitement of a wedding party. As one Syrian refugee girl highlighted, I don't want to have a corona wedding. The contrast we've seen in some parts of Ethiopia, so specifically in the Amhara and Afar regions, that it's really led to an explosion of child marriages. So this has been the case where lockdowns have coincided with the traditional marriage season. And because with school closed and district level employees prevented from traveling and working at home, surveillance and reporting mechanisms against harmful traditional practices have faltered. What's interesting, and we highlight in our new brief, is that girls who are temporarily out of school are especially at risk, but also boys, even those who are attending secondary education, report in some of these localities that they're being pressured to marry now. Next slide, please. So in the coming months, we'll be doing follow-up research, and the things we want to really be watching out for, and I think will be important to look in other contexts as well, is what is happening once girls who are out of school now, to what extent will they be re-enrolled once schools do open up, given the limited value in many communities still accorded to girls' education and the preference for child marriage. Interestingly, also in East Harage, where we found that girls were not facing increased risks at the moment, we think it'll be worth monitoring very closely when the marriage season does start later in the year, what will happen to girls in those localities, particularly because our findings found that many had been subjected to female genital mutilation and cutting, which is often a precursor for child marriage in those localities. It's also important to highlight that awareness raising efforts against child marriage and efforts to shift social norms have also come to a standstill at this period because of the state of emergency. And we're also hearing multiple reports that because of the focus of health services on the COVID emergency, that access to contraception and family planning services has also become more problematic. And as Tia highlighted, when unmarried girls fall pregnant, then child marriage in many of these contexts will almost certainly result. Next slide, please. So I also want to just briefly touch on our findings about the ways in which COVID-19 has impacted the lives of married girls. And 5 key impacts have sort of emerged. One is reports about food insecurity and poverty having escalated, and real challenges that young mothers are facing in catering for the basic needs of their infants. Secondly, married girls have highlighted that they're having to spend even more time collecting water due to the focus on hand washing as a key prevention measure, but that's then detracting from other subsistence needs in the household. We've heard across different contexts, as this quote here from a married Syrian girl in Lebanon highlights, that there's also been escalating rates of intimate partner and gender-based violence, and that the emotional toll of the pandemic and the extra stress, particularly with households all family members being at home, particularly in extended family arrangements, this has been exacerbating married girls' stress. And then, as I highlighted, also that SRH services have become more challenging to access, and that families are having to access care through private clinics when they can scarcely afford that, as this quote from a girl in Jordan highlights. Next slide, please. So I'd like now to turn to question 2 and to reflect a little bit on what we know from the evidence base about what works to end child marriage and support married girls, and what's the role of social protection within that. Next slide, please. Next slide. So here I'm just drawing on some of the findings that we've had from some of our tools that we've used with parents and with grooms, so adolescent boys and young men, about what it would take to shift their preferences for child marriage, who would be influential in shifting attitudes, and what kind of incentives, including social protection, would need to be in place. And if you're interested, we have the toolkit online. Next slide, please. So in general, what has emerged from the evidence base to date is that in order to reduce child marriage, and I'm sure Rachel and Nankali will talk more about this, is that it's critical for girls to have options other than marriage and motherhood, and to be actively supported to achieve them. So particularly in terms of accessing and achieving in their schooling, empowering girls with knowledge about options other than marriage through role models, and through strengthening girls' voices to demand the rights to pursue these options, and at the same time strengthening parents' support for their daughters' alternative futures. And finally, I think there's a lot of evidence showing that even if you work with adolescents and families, if you don't simultaneously invest in strengthening systems and services to support girls and their parents, to invest in these alternative futures other than marriage, and to sanction violations, then the results will be limited. So next slide, please. So what role can social protection play? I think picking up on some of the points that Tia was making earlier, that social protection can address some of these drivers, but not all. So firstly, there is a growing evidence base that cash and stipends can help keep girls in school, particularly through alleviating worries about school materials, about uniforms, about transport costs. That in-kind support can also help girls succeed in studying and putting in the hours that they need to do well in school, and that school feeding as well can increase the desirability of school, both from an adolescent perspective, but also from a household perspective where food security is an issue. Cash and food vouchers may also reduce the need of households to rely on child marriage as a coping strategy. So this was a reflection here from a Syrian father who took part in our scenario tools. And he argued that I think if a father has enough money that covers him and his family, and he can afford to educate his daughter, I think he will change his mind about child marriage. So it could be the incentive that's needed to override some of the dominant gender norms. And finally, there's also some evidence suggesting that cash and vouchers, for example, could reduce household stress levels and age and gender-based violence that may be triggers for girls to accept proposals of marriage to escape stressful home environments. Next slide, please. So finally, with the third question, how should social protection be readjusted to address COVID-related risks and protect adolescents from an in-child marriage? So I'd just like to conclude with some thoughts on this question, then look forward to discussing it further in the Q&A session. Next slide, please. So in the context in which our research is being carried out, what we have seen so far is that while there's been a lot of attention around social protection, that actually the adolescents involved in our research sample across the different sites have actually seen very limited evidence of an increase in support in social safety net measures during the pandemic. So, for example, in Jordan, the labeled education cash transfer, the Hajati program, it has scaled up. There's a one-time cash payment available, and there's also been efforts by UN agencies, including WFP, to ease the use of food vouchers from different stores to improve diets, but overall there has not been an adjustment of these transfers for inflation, and the numbers of families being reached are still very low. So with that program, for example, it's 8,000 to 10,000 households. In Ethiopia, there's also been quite a lot of discussion about the urban PSNP scaling up, but amongst our urban sample to date, we've seen very little evidence of that reaching new families, and particularly targeting migrant adolescents who are living alone. And similarly in Lebanon and in Bangladesh, at least the young people involved in our sample have not received any additional support, and many are having to rely on informal safety net measures and charity from neighbors, for example. Next slide, please. So what does this mean in terms of adjustments that are needed to better mitigate these risks of child marriage, but to also support adolescents that are already married? I think what's critical, at least four key pillars to embed within the scaling up of social protection initiatives at this time. Firstly, it seems critical that social protection is used to support girls to keep learning even while schools are physically closed, and to make sure that there's improved access to distance learning materials, whether that's through physical books or online approaches, and that there are mentors where possible to support young people to access these materials effectively. And then that is then complemented by a cash incentive for re-enrollment once schools do open, and perhaps particularly for girls who are at higher risk of staying out of school. Secondly, it seems that increasing the transfer amounts to cater to rising unemployment and underemployment in many of these contexts. So this will enable girls' natal families to be protected from being pushed to consider child marriage as a means to mitigate food insecurity and poverty. And at the same time, that would hopefully have positive spillover effects on reducing stress and violence within the household, which may, as I said before, also be a driver of child marriage in some cases. I think it's also urgent that the social protection initiatives are closely linked to a focus on SRH awareness and services to really ensure that girls are not going to be pushed into marriage by accidental pregnancy. And we've heard in urban areas growing concerns about violence, physical and sexual violence on the streets, and so this seems to be particularly urgent. And then finally, I think it's vital that we consider a cash plus approach, so that while cash or public works can help to tackle economic insecurity, there's also an urgent need to be strengthening referral mechanisms for the very high levels of mental health and gender-based violence that initial evidence is suggesting. So thank you very much, and I look forward to the discussion later.
Thank you, Nicola, for that very interesting presentation. It's really great to be getting real-time findings from those 4 settings that you have. So our next presenter is Nankali Maksud, and I would just like to remind our audience members that you're welcome to put your questions in the chat box throughout the presentations, and then we'll answer them at the end.
Thank you very much, Tia. Can you confirm that you can hear me?
Yes, we can hear you.
Brilliant, thank you so much. So thanks to everyone, good morning, good afternoon. My name is Nankali and I'm the coordinator for the Global Program to End Child Marriage. Quickly, this program, for those who are not aware, is being implemented across 12 countries within South Asia, within Western Central Africa, within East and Southern Africa, and also in the Middle East. So my presentation is about that program and how we're addressing social protection within the context of that program. Next slide, please. So the outline for the presentation, we're going to look at drivers of child marriage, and I'll run very quickly through that. I think both Tia and Nicola have addressed that very well. I will then move to the global program approach to social protection. I'll share some country examples of what our experience has been going so far, and then also look at what we can, put forward some way forward asks for all the partners who are taking part on this webinar. Next slide, please. Now, I think what has already been presented by everyone is the multiple drivers that we have for child marriage. We know that there's a combination of factors that lead to child marriage, often poverty, deep-rooted gender unequal norms, the absence of services, and now we also have an increasing body of knowledge on the impact of conflict as well on child marriage. However, one thing that I'd like to highlight, which I think Nicola also was referring to, is that within the context of the global program and also from other partners as well, we can now see an additional body of knowledge also coming up in terms of child marriage not only happening within coercive contexts. Within Nepal and Zambia, we now have 2 major pieces of studies and others coming out in other parts of the world, which shows where there's lack of opportunities and conservative communities, this is resulting in adolescents eloping or marrying voluntarily. So in sum, there's multiple drivers for multiple drivers call for multiple solutions, and reducing vulnerability on its own would not be able to mitigate the impact of child marriage or child marriage by itself. Next slide, please. I want to bring you within the context of the global program. This slide speaks to the key pillars in the second phase of the program. We had the first phase of the global program running from 2016 to 2019. Based on the lessons that we've learned and the evidence that's coming out from our many partners, including the great work that's being done by Gage and many others, we've done a number of shifts. Within the first phase of our program, we acknowledged social protection as a key intervention, but I think it's fair to say that in this second phase, it's highlighted a lot more and at multiple levels. You'll see within these pillars that we're looking at social protection, first of all, working at it in terms of supporting marginalized girls directly, looking at how we support, through family and community environment. We're engaging in terms of system strengthening, and I'll give examples through that. And then we're also engaging in terms of laws and policies, and of course the data and evidence similar to what has been presented. So our engagement on social protection as it relates to child marriage is at all of these 3 fronts for the global program. Next slide, please. Also thought it was important for us to be able to show you our results framework. Here you can see the outcome indicator and the output indicators that we have. These are being monitored and reported on across all 12 countries. I think the previous presenters have highlighted, though, that while this is a key intervention area, it's not one that is featured across all the different countries. So, you'll certainly see it within Ethiopia, you'll definitely see it within India, Bangladesh, Nepal, but in some of the countries it's not there, for example, Burkina. And so for those countries where we don't have this as an intervention area, our work is really very much around advocating that this is something that countries and governments should consider as a part of their national programs to address child marriage, and becoming even more important now within the context of COVID. Next slide, please. So the global programs approach, I mean, we, as has been presented before, we are drawing on global evidence on the effects of social protection measures on vulnerabilities that lead to child marriage. For example, not being able to attend school. We know that the evidence is mixed and thin, as other panelists have already shown, but we know from research and evidence that there are positive effects, especially around school attendance and delaying marriage, and this is definitely something that we would still work towards on. The global program follows a three-pronged approach where we're leveraging, where we provide some in-kind support, and where we provide TA. Linked to all of this is also a significant bit of work around public financing for children, which is an emerging area of work, where we're not only calling for direct support, but we're actually advocating with government so they can be able to put budgetary allocations around programs such as this for social protection. I would just want to say, certainly now within the context of COVID and the economic impact that's going on at family level, at national level, we have increased significantly our work around budget advocacy, and it's of course informed by the evidence of kind of what works in terms of improving kind of school girls attendance and delaying marriage. Next slide, please. Social protection for us is a part of gender transformation. In the first phase of the global program, we had an external evaluation, and one of the key issues that came out is the extent to which we have a gender transformative approach, and it wasn't felt that we did significantly in that first phase. And so our second phase, which will be running over the next 4 years, is really expanding that gender transformation approach. And this diagram here, which I'm sure many people are very familiar with, is what's driving us. And you can see that we're approaching this at multiple levels: individual, interpersonal, community systems, and at policy work. And to that extent, that's the way that we also program around issues to do with social protection. Next slide, please. Now, specific country examples that I wanted to be able to share with you. In India, so far we've looked at the strategies, the results framework. Within India, the global program is supporting large-scale adolescent girls, focused programs on cash transfer schemes. We have different approaches in different countries. In India, these programs are run by government at state level, and so our input is around technical support to enhance those mechanisms, to ensure that they also take our target population into account, and also address issues like the plus components that Nicola has already been referring to. So here you'll see in India, we've influenced the West Bengals, as an example, Kayashri Parakla. I don't want to murder the name of that, and several other cash transfer schemes and programs. The West Bengal scheme has a reach of 4.3 million girls through conditional cash transfers to incentivize their continued education and prevent child marriage. But we are working at state level to look at how we can build in these additional plus components. So, for example, transformative life skills, boys engagement, SBCCC, and adolescent-friendly health services. In Ghana, the global program has, again, supported government there to identify communities benefiting from the Livelihood Empowerment Against Poverty program, which is a government-run unconditional cash transfer program targeted at pregnant women and women with children under the age of 15 in extremely poor households, aimed at reducing poverty, increasing consumption, and improving child nutrition. Here, the global program has set up safe spaces in those communities where the program is being run, to target marginalized girls and to provide life skills training and adolescent sexual and reproductive health services. So really trying to kind of bring in plus components to make the programs have even greater impact than they already do. Zambia, we're also working there, again, always to look at how to be able to improve those programs. The global program is engaged with the World Bank in supporting marginalized girls to be able to go back to school. Next slide, please. So some of the lessons that we've learned, we're highlighting India, but of course we're learning a lot of lessons across all the different countries that we're implementing on. India is, for us, one of our global program countries, has probably the longest running national or state level cash transfer programs. And so for us, it's an excellent place for us to be able to learn and be able to share with other countries, not only within the context of the global program, but globally as well. Here, we've made significant investment in terms of research on child marriage drivers, and many of them have already been shared, but also undertaken reviews of cash transfer schemes. And these studies are there, for many people to be able to learn on, what works or doesn't work across the different contexts, and what additional components can be built within that. Some of the gaps in the cash transfer schemes that we've picked up, are highlighted within this slide. So, for example, you would know that we have unclear theories of change, the causal links between barriers and the expected outcomes for cash transfers sometimes are not so clear. We are calling for greater recognition around, the multiple and complex drivers beyond just economic poverty. Economic poverty seems to be one that everybody is clear on, but we're trying to raise, what are the other issues that are also leading to vulnerability for these girls and households. Multi-sectoral programming is another area that we really kind of want to highlight, but rarely done in a kind of convergent manner. It still tends to be very kind of vertical programming, and it's something that that we continue to advocate for in terms of improving these programs. And now, of course, within the context of COVID, we're also looking at how to be able to adapt. I think either Nicola or Tia already spoke to this. How can we ensure that we increase the fiscal space, the budgetary allocations around these programs, and how can we target in households where we know they are particularly vulnerable girls and families who require the additional support. Next slide, please. So this global program strategies within the context of COVID, we continue to learn, I think, like many others, and we've identified kind of 4 things that we would like to do, or we're advocating for. Some we're implementing directly, some we're advocating for our partners to be able to do. One, is around data generation and tracking the effects on child marriage of COVID. So that is being done consistently across the 12 countries that we're working in, but I should say for both UNICEF and UNFPA, data generation and tracking is active over and beyond the 12 countries. We're looking at, what kind of interventions are required to reduce vulnerability of adolescent girls in terms of learning, health, and protection. We're looking at how to alleviate those household burdens. And then the final point is that, our continued work with partners and advocacy, learning from, for example, from Gage. It was really great to see the presentation that Nicola did in terms of, what's the evidence out there and how do we adjust our programs. I think many of us have been challenged within the context of COVID in not having as much data in terms of how it's impacting on child marriage specifically. And so it's been really great to be able to have researchers such as Nicola to be able to bring that to the fore, and for us within the context of the global program to be able to make the necessary adjustments. Also within the context of partnerships, of course, is, Rachel's coming in next, is the work that we continue to do with partners such as Girls Not Brides, through webinars, etc., to bring to the fore how child marriage is impacting, and how COVID is impacting on child marriage, but more importantly, hearing from the girls themselves directly on how it's changing their lives. Next slide, please. So our final slide, to all partners who are on this, and it's been great, thank you, to have been invited onto this webinar, is, the global program works only in 12 countries who we feel like 12 countries of kind of with high prevalence rates for child marriage. We don't think that we can do anything by ourselves, and so we are very happy to work within the context of partnerships. And so one of my colleagues thought it was good to put in this quote here: if you want to go fast, go alone, and if you want to go far, go together. I think many people have already seen that. Similar to the previous presentations and also to mine, the issue around being conscious of, that there are complex and multiple drivers, which call for multi-sectoral interventions. I know that we keep saying this, but because as long as we don't address it, then it's something that we keep having to come back around to, and so we'll keep highlighting that. Social protection is necessary, but not it's not the only. Somebody was asking me last week. I remember that it's not the magic pill. It's an excellent way, an excellent intervention. We know there's evidence behind it and growing evidence behind it in terms of kind of getting girls back into school and delaying marriage. But we know that we need to do many other things in addition to social protection. So, for example, within the context of the global program, we've got girl empowerment programs also running at the same time. We've got, we're ensuring access to services such as sexual reproductive health service, getting girls back into school, which is closely linked into the social protection. We're ensuring that, girls are growing up in a safe environment, and also school is safe as well. So many other issues that are going on that also need to be addressed in addition to social protection. Already raised a point about achieving scale requires, broad and new partnerships as well. The need to distinguish humanitarian and development context. I think COVID has really kind of brought this to the fore for us. And actually, just reading that now, I think the continuum between development, I would change that to the importance of that continuum between development and the humanitarian context. I think COVID has thrown us all in together, and so we really need to look at how we bring those two sectors together to be able to respond more effectively. Investments for more nuanced evidence of what works for whom and to achieve what where. I think even when you look at the context of COVID, how it's impacting and affecting in India is totally different from how it is in Ethiopia versus Burkina, especially when you look at many other factors that are going on within those countries. And so really looking forward to the continuous knowledge that is coming out of partners, researchers such as Nicola through the GAGE mechanism to build awareness and ensure that we're designing programs that are responding to the context that we're in. So most partner priorities are relevant, for child marriage. Yeah, we're really grateful. I think for me during this period of COVID specifically, I've seen especially the education sector who've really been a kind of forefront, definitely within the UNICEF environment, have really spoken to the importance of ensuring that girls quickly get back into school, not just for educational outcomes, but for protection and for preventing issues such as child marriage. Next slide, please. Here, this is my final slide. Just before I say thank you, we've during this period of time for COVID produced a number of technical notes within UNICEF, within UNFPA, and for those who are familiar, also within Innocenti as well, through the GRASP mechanism. There are links that I think the PowerPoint presentation will be shared, and many of the colleagues can be able to reach out through this and get more information on that. That's all for now. Thank you very much from me. Thank you.
Thank you, Nankali, for giving us that global perspective and telling us what the global program is doing. That was very interesting. Our next presenter is Rachel Yates.
Great, thanks very much, Tia, and to the other presenters who've set the scene very nicely for what I have to present. And I will skip over areas where I think there's possible duplication. So on to the next slide. So early on, after lockdown at the start of the pandemic, we were getting alarming news from many of our members worldwide, and stated at the beginning, Girls Not Brides works with over 1,400 organisations in more than 95 countries. And it was quite clear that the pandemic was having a major impact on people's lives, particularly the poorer, more marginal households whose incomes were being decimated, but also as a result of the lockdown, which was having a massive impact on access to education and health. So early on, we developed a brief which was reflecting some of these initial findings. And within it, we did make a reference to the importance of gender responsive social protection as a response. At the time, we were still unclear what exactly this would look like. And what I'm really excited about this call is it's an opportunity to really sort of flesh out some of these ideas and identify what are the priorities in the present response. Next slide. So some initial analysis has been done by UNFPA about what could be the potential impact of the pandemic on child marriage. And these initial modelling exercises show that an additional 13 million child marriages could occur before 2030 as a result of the pandemic. And this is partly due to the disruption in programming, which would have been taking place otherwise. But a large part of the impact, in fact, 5.6 million of these additional marriages is due to the anticipated reduction in GDP per capita at a household level, but also the broader economic impact that that will have on availability of services. So this is why we think that it really is important to start planning now to look at these gender responsive social protection programs as part of the mitigating the crisis now, but also in preparing for recovery. Next slide. So we've had a lot of consultations with our members in different contexts, and really hearing massively what have been the sort of the impacts of child marriage on their lives. Particularly in terms of education, we've been hearing about concerns about girls dropping out of school, and where schooling is available, it's been going online, and many of the poorer girls don't have access to the resources or data, which may be a key barrier to access. So the cost of education in many contexts, it appears is becoming unaffordable for the households, particularly day wage labourers whose households have been decimated. And there is a real concern that many girls won't go back to school after the present crisis. And this isn't just economic impact, it is also down to the sort of son preference that Nicola mentioned at the beginning. So we do need to think about the combination of social and economic reasons why girls may not return. We're also sort of hearing a lot about the concern, which we also see in a number of other sort of humanitarian crises, about where there's a sudden income shock. What does that do to child marriage? And particularly that households sort of prioritising sort of essential expenditure on, say, food or fuel would sort of see the economic burden of daughters and looking to sort of accelerate marriages. Although we are also hearing, as is Nicola, that sometimes marriages are delayed because of the cost of weddings themselves. But our anticipation is, and what we're hearing from our members, that after lockdown, there could be a sort of sudden increase around these sort of weddings. So a lot of what we're hearing from our members does coincide with also what's coming out of the research that Gage has been doing. And you know, also in terms of sort of massive health impacts as well, in terms of psychological health, in terms of access to sexual and reproductive health services. And I'm sure many of you have heard of the shocking impacts on reproductive health in Zimbabwe and increased maternal mortality as a result of COVID, so we shouldn't forget that. Next slide. So like Nankali, I would agree that there is no magic bullet for tackling child marriage. And I think the sort of takeaway message here is that we both need to look at the social and economic drivers and aspects of child marriage. And I think the critical question is, how do we combine some of the economic interventions with some of the social norms interventions, which we know are also key drivers of child marriage? I have just illustrated here on our theory of change, where increased economic inputs can make an impact on the lives of girls, on the availability to services, but also the legal and policy changes that can increase access to social protection. And I think that overlaps with a lot of what Nankali presented. So I'll move on to the next slide. So getting back girls into school, I think we're all agreed, is a critical pathway for mitigating the impact of COVID on child marriage. And I think one thing just to sort of flag before we get into the cash transfer question, I think one of the issues that we're concerned about is that with declining fiscal space for education, the worry is that there's going to be a hike in school fees, both for primary and secondary. So as articulated by a young woman who was consulted as part of a Young Voices survey recently, there is a real concern that poor families can't access higher education and the importance of making education free and accessible. So before we even get into any sort of targeted transfers or even universal transfers, I think free education, we just need to keep on advocating for that as an intervention at scale. Next slide. So we are seeing some quite exciting new programs being developed, and I think it's actually 200 programs, I think Tia mentioned, have now been introduced as a result of the COVID response, many of which are gender blind. So for example, in South Africa, the Child Support Grant beneficiaries are now receiving additional amount of money as a result of COVID. Now, many of these programs have been shown already without any add-ons to have a significant impact on girls' education. And I think 12 out of 15 studies where there have been disaggregation of impact have shown school attendance increasing for girls from a recent study in 2016. But I think what we would really advocate for, and I think this is where the gender transformation element comes in, is the need to actually combine some of these interventions to address the economic drivers with complementary investments, particularly for older adolescents, around comprehensive sexuality education, supporting community conversations to work with parents about the need to get girls back into school. And also thinking about sort of vocational training so that education is actually seen as a means to brighter futures and not just an end in itself. Next slide. Nankali referred a bit to cash plus models, and I think for me there's a lot of interesting models being developed, and I think we do also need to look at the HIV world, where they have been piloting some cash and care models at scale, which have been really looking at reducing HIV risk behaviours in adolescents. And from a recent consultation we had, many of the drivers of child marriage are very similar to the drivers of HIV risk. So there are potential programs that are working at scale that we can look at and adapt in the context of child marriage. So for example, in South Africa, they have scaled up a cash plus program looking at cash transfers, free education and parenting support, which has reached over 30,000 households and had impact at scale. I've also highlighted here an interesting program that was piloted in Liberia with the Population Council and World Bank support. And although this did have an impact on gender attitudes and life skills, it didn't really shift gender-based violence. And my takeaway from reading this was perhaps if there had been an additional component looking at tackling the harmful social norms, working with parents, traditional leaders, this additional component, could it have potentially have had additional impact? And I think these are the sort of programs we need to pilot. I think one of the challenges we'll face during COVID is obviously how do we do community conversations when we are all being socially distanced? There are some interesting approaches that I think we can explore in parallel, including virtual and online safe spaces programs. And UNICEF, in fact, is piloting one in Lebanon and Iraq, which could be a good complementary intervention to go alongside cash transfer programs. Next slide. Another thing that I think from our perspective and from our members' perspective is really important is the need to have sort of broader consultation in the design of these programs. Girls Not Brides has been working with a number of other civil society partners in India and has consulted recently with 2,500 young participants to get their views about what they want from government, particularly in the context of COVID-19. And there was a very loud call for increased social and financial support for families, so that this will sort of delay child marriage. So clearly girls themselves are seeing economic distress as being a major risk to them in case for them to get married early. But at the same time, we're learning a lot from some of the cash transfer programs in India that some of the conditioning has not been particularly helpful, and that programs that are conditioned on child marriage per se may actually be counterproductive. So that in India, where girls have married at 18 because parents have perceived the cash transfer to be a dowry payment rather than as an incentive to delay marriage. So the messaging around cash transfers is critical, and possibly had messaging been based on education or looking at increasing girls' opportunities, there could have been different outcomes. So again, I think we need to look at what we're conditioning on. And this also speaks again to the need to tackle harmful gender norms in parallel with both conditional and unconditional programs. Next slide. So finally, there's clearly a lot of good areas for exploration, and some of the areas I think we need to sort of focus on as a community is thinking about how we build child marriage, but also other adolescent wellbeing outcomes into existing programs. So of these 200 programs that are being developed, is it possible to actually introduce measures of child marriage and early pregnancy so we can see the impact that they're having? So the other area I think we maybe a plea to donors is actually adding an operational research component onto existing cash transfer programs. So for example, I understand in Rwanda, DFID is looking at combining a safe spaces program with a cash transfer element to see what the additional impact of that is likely to be. So these more experimental designs I think will build up the evidence a lot. I think also we do need to think about how do we take this sort of dialogue between social protection experts and child marriage specialists into a national and subnational level. I do feel that they are quite distinct communities, and I think there is a need for better dialogue to bring in the gender responsive and gender transformative elements into these programs at a national level. And within this, there's a critical role for civil society to play in promoting the accountability of cash transfer programs and ensuring that there aren't these sort of harmful unintended consequences as we've seen in some of the sort of conditioning. So interventions like Young Voices in India is a really good way of hearing from young people themselves about the priorities and the combined interventions that are needed. So we're keen to move into a discussion, so I will stop there and really look forward to hearing the questions to the panelists. Thank you.
Thank you very much to Rachel for that fascinating presentation. Now we are going to move into the question and answer session. So we have some questions already, but I'd like to continue to encourage you to continue posting additional questions. And again, if we're not able to get to all of your questions today, we will post all of the questions and responses on socialprotection.org, and that will be made available a couple of days after this webinar. So I'm going to go backwards in terms of our presenters. So one question to start us off with for Rachel, this question speaks to Cash Plus and integrated social protection. So Farid Dasgir says, noting the contexts are different based on different cultures, in some areas the groom pays a bride price, while in others the bride family has to pay for the dowry. When the cash transfer program is relatively smaller than the perceived income, how can social protection be implemented effectively to obtain the desired result?
I think there's a number of things to consider here, and I think the question sort of slightly answered itself, and that is really understanding the sort of contextual drivers in a particular context, and to what extent is child marriage being driven by an economic shock in which case that would sort of suggest that maybe some larger economic intervention is needed, not necessarily at the level of the girl, but the level of the household to reduce that distress. Whereas in other contexts where it may be a phenomenon that's seen against richer households as well, where it may be sort of more normative, that I think can sort of determine the sort of the balance of cash or economic interventions versus other more sort of social normative interventions. So I don't think there is, you know, a one size fits all. And I think if programs are being developed to have a child marriage outcome, the research into understanding what are those critical drivers from participatory work with families and girls themselves is a critical prerequisite. But I'd be interested to hear what other panelists say as well.
Great, thank you. So 2 questions for Nankali. The first is, and Rachel gave an example of this from South Africa, but a question from Claire McCrum at DFID, do we have good examples of plus components operating well at scale? And are there examples of operation through governments in lower and middle income settings? Your second question, Nankali, is from Michael Sampson at the Economic Policy Research Institute. You make a very good point about social protection not being a magic pill. The evidence is that it often works best as an enabler of intersectoral synergy, but only if key stakeholders work together. Can you say more about the success in motivating this cooperation and what can be done to encourage key stakeholders to work more effectively together?
All right, thank you very much, Tia. Good examples of cash plus programs. I think we've made the most progress in India and at state level. The one that comes immediately to mind is what I presented in West Bengal State, the Kai Shiri program, where we've been able to advocate to include plus components such as, you know, girl empowerment programs, LinkedIn, you know, for example, access to life skills for girls. And that's something that we carry on to advocate across in other programs. My experience has been that there's such a focus in the college, and so it's been great actually to have this webinar, because my experience has been that for those colleagues who are assisting governments to design these type of programs, the focus is so much on addressing economic impact and poverty-related issues that the plus components are not necessarily seen as something that would add value, and the issues of whether we have enough fiscal space to bring those always comes to the fore. I like that Rachel brought up the issue of HIV. Both Rachel and I worked in East and Southern Africa, and so we were looking at kind of HIV social protection programs. And in that case, you know, as cash transfers, and great to have also Michael Sampson here, who really led a lot of the design and capacity building for that region, really made a case on, you know, how do we not only, it's great to start off with cash transfer programs that are focused, that can be able to show results, but, you know, can we build these additional components over time? And the cost of that, or the budgetary implication, should not just be on the focal or the nodal ministry, can spread across others. So how do we bring in the Ministry of Education, Ministry of Justice, etc., others to also bring in their budget contributions? So the discussion around fiscal space, it can be put to the side, that everybody brings something to the table. Michael, on the issue of multi-sectoral response, I mean, really important. Again, my experience has been, especially coming from my last post in Malawi, a big learning is the capacity of the nodal ministry being able to convene others and bring others around the table, and then be able to design something in a multi-sectoral manner. I think for most of the cash transfer programs, in my experience, is very heavy from East and Southern Africa, is that the departments that are leading social protection sometimes tend to be kind of inward, or just don't have the capacity to be able to convene others, so you can be able to really be able to bring in these other sectors into that. But I can definitely say where we are today in 2020 to where we were perhaps 2010, even 10 years ago, is completely different. That we're now having, I mean, I certainly see within the UNICEF context, our social policy colleagues are talking about the importance of the class components, the importance of bringing social gender transformation, etc. So we're definitely heading towards the right direction. Sorry, Tia, I just remembered I should be time conscious. Thank you.
No worries. Thank you for those excellent answers. So for Nicola, we have 2 questions now. The first is from Nina Larson from DFID, and she wants to know if the age at first marriages is changing. Are girls and boys being married younger or older as a result of COVID-19? And we have a question from Elsa Marawi. How can governments be involved in order to ensure a comprehensive approach to gender transformative social protection?
Great, thanks, Tia. So on the first question about whether preliminary evidence is suggesting that young people are getting married earlier during the pandemic, so from Ethiopia, in rural areas, we're hearing girls getting married at 12, 13. And I think, there definitely has been in these communities an upward trend prior to this sort of, 15, 16, 17. So I think that's certainly alarming. In Amhara, I mean, often boys don't get married until they're in their early 20s. So the fact that boys who are also school going, who are 17, 18, 19, are getting married very quickly is really a concern. And I do think that parents who had tepid support for education are really using the lack of surveillance at this time by teachers who are often, critical ports of call to report impending marriages. The fact that they've gone back to their hometowns, they're not there, other government workers are having to work from home. I think, these are gaps in the system that parents are making advantage of. So I would say generally it seems to be going down, which is unfortunate. In terms of the question about governments working across sectors to have a more gender transformative approach to social protection, I mean, I think it's critical, as others have been saying, not to locate the types of programs we're looking at in the weakest ministries. I think it's really critical that we're locating these investments at this time in a supra-ministerial body, for example, the Prime Minister's office, rather than in weaker and poorly resourced and with weak capacities, ministries like Women and Children or Social Development. So I think that's a first key step. I do think we've seen cross-sectoral responses with national governments putting together cross-government agency committees, from federal down to district levels in many contexts at the moment. So I think this is really a very good opportunity to build on that. I think we're seeing these committees come together and taking on different agencies' work to ensure maximum coverage in a rapid and timely manner. So I think that's certainly one opportunity, but we'll have to make sure that it's not just about targeting girls and women, but we're actually looking at what are the gender constraints. And so actually taking time to do, as other panelists have highlighted, proper gender-related vulnerability assessments to make sure we're looking, yes, at the vulnerabilities that underpin child marriage, but also a range of other gender constraints that affect girls, but also affect boys. I mean, we're seeing a lot of evidence on boys being subject to exploitative agricultural labor, in urban environments where there's no protection. So I think, if we go with that gender lens, hopefully we'll also get a broader buy-in from a wider range of stakeholders.
Great, thank you. Another question for Rachel from Christopher Mwembe. To what extent can cash transfers address gender inequality during the COVID-19 era?
Obviously, this is a very new area, and I think we have an opportunity really to build some of the evidence. I mean, generally, the evidence around social protection and child marriage, in fact, the evidence on child marriage in more humanitarian settings is limited because there are challenges in doing the data collection. My sense is because child marriage also is a bit of a lagging indicator, and the most reliable surveys are MICS and DHS, which you don't get for, say, 3 to 5 years, that there's a really good opportunity really to build in some of these sort of indicators in some of these ongoing programs. And particularly I would put my money on girls' education outcomes, maybe early pregnancy, which could sort of show up quicker. So I think what we're hearing is that, I think from the evidence that's been presented, that the potential is really there, but we are still lacking some of the hard evidence. There is, though, good evidence coming out of some of the Ebola responses about what happens down lockdown and what gets girls back to school. And some of that also pointed to economic incentives for getting girls into school. So I think that the potential is there, looking at what the drivers of child marriage are, but we need to build up the evidence base, and this is the time to start.
Thank you. For Nankali, Richard Ishun would like to know what programmatic work is being done to support young boys and engage boys.
Okay, thanks so much, Tia. I think if we're honest, we haven't given as much attention to boys as we have girls, and within the context of child marriage programs, and there's a reason for that. Girls for sure are disproportionately affected, but for many of the programs, especially around empowerment, within the context of the global program in Nepal, in Bangladesh, even those in Africa, they include mixed groups of both boys and girls. And most of the time, this comes at the request of young people themselves. We are very happy and very focused on girls, but as we go forward, I hope colleagues have seen that. I think not last year, but the year before, we came out with data around boys as grooms, sorry. And we have young boys also in our empowerment programs, and so it's an emerging area of work that we need to enhance further. I must say that it's an area where I feel we need to understand better. At the moment, when we say that we're bringing in boys, we just bring them onto the existing program. I don't think we've spent as much time to be able to understand, what exactly is going on in boys' lives and what is it that would add value. So the instinct is to immediately bring them onto the empowerment programs. But those empowerment programs are not then readjusted to look at what is it that's going on in boys' lives in terms of, improving their outcomes. That we need to be able to address. So we've started. I think we're in the right way, but a lot more needs to be done in terms of addressing boys. Thanks, Tia.
Maya Gavrilovich has a question for Nicola now. Her question is hypothetical. If you were an advocate engaging with a policymaker and advocating for integration of child marriage focus into social protection programming, would you advocate for a specific girls-focused intervention or leveraging the National Social Protection Program, if one exists, that may have a range of household level poverty reduction objectives, but not necessarily aiming to address child marriage? What would be the pros and cons to consider in making a choice on the approach?
Okay, very good question, Maya, as always. So I think maybe I would repose the question perhaps to say I would be advocating for an adolescent responsive program. So not just girl focused, but looking at girls and boys. Not only because, as Nankali's just said, there are important vulnerabilities that boys are facing vis-a-vis marriage, even if the numbers are much smaller, but also because that many of the drivers, so economic poverty, conservative gender norms, household dysfunctionality and violence, they can lead to child marriage, but they also may lead to distress migration, and then young people ending up in very vulnerable situations in urban environments. And we're doing some research at the moment with UNFPA with very vulnerable urban youth, and I think that's really highlighting that we need to have a more comprehensive adolescent responsive social protection package. Many of the drivers overlap, and I think, as Rachel and Nankali also mentioned, as they do in the case of programming to address HIV. So I think I would put a lot of emphasis on age and gender responsive programming. I think just working at the household level we've seen does not work for children and young people. There's too many gaps around these complex vulnerabilities, but I would also not go as far as to only advocate for a girl-only approach. Thanks, Tia.
So I just want to give 15 seconds to each of the presenters if there's anything additional they'd like to add. We need to wrap up soon and I have some closing remarks. So if there's any of our panelists that would like to say a few closing words, please do so now. Rachel, do you have anything?
Just very briefly, in responding to a question that's also come up about teenage pregnancy, and I think in parallel, and I never know what happened to the social protection floor and if that's still a thing, but universal healthcare we haven't spoken about. I think sort of free access to healthcare, absolutely essential, and we need to sort of guard that during the contraction of fiscal space. And I think that needs to be a key advocacy ask in addition to the scaling up of cash transfer programs.
Thank you. Nankali, anything to add?
Thanks, Tia. It's been great to hear. I think yourself and also Rachel talk about these 200 new initiatives, or that are being adapted as well. I think there's such a great opportunity there for us to be able to tap in as people working within the child marriage sector. I think many of us tend not to know, so really great to hear that that's out there and there's that opportunity. So really encouraging everybody to be able to engage in that, to see how we can be able to influence that, because I think there's no doubt for all of us in terms of the economic impact on COVID on households and on girls. Thanks so much.
Thank you. Nicola.
And just a plea to invest more in mechanisms so that we can rapidly scale up social protection when there are these kinds of mass shocks that are affecting so many. I think that while I share the optimism that there's lots of positive opportunities that we can all contribute to, overall I think the responses have still been quite slow, and many people are not being reached and are living very precarious lives right now. So I think we need to get better at rapid scaling up.
Thank you so much. This has really been an excellent panel. I'd really like to thank our panelists for providing really key insights. And behind the scenes, we had some phenomenal organizers of this webinar. So I'd really like to thank the organizers. We learned in this seminar today some of the pathways through which COVID-19 is increasing child marriage risks, and these include lockdowns and school disruptions, increased violence against girls and women, and economic impacts. Moreover, marginal girls often face multiple vulnerabilities. We heard that an additional 13 million marriages before 2030 might be induced by the pandemic, including through increased poverty channels. Our presenters reiterated that there's no magic bullet for tackling child marriage, that we need to tackle both the social and the economic drivers, but that social protection can help target these key drivers. Evidence from Gauge shows us how in Jordan and Lebanon, stay-at-home orders have decreased employment, income, and child marriage. In contrast, we learned in Ethiopia, COVID-19 has led to an explosion of child marriage and weakening of surveillance and reporting mechanisms. Some recommendations from Gage's research include supporting education, increasing transfer amounts, focusing on sexual and reproductive health awareness, and supporting Cash Plus or integrated social protection programming, which builds and strengthens referral mechanisms for mental health and other services and protection systems. Social protection is a core strategy with UNICEF's global program to end child marriage, and they aim to increase partnerships with governments, civil society organizations, and other implementers to ensure that social protection reaches the poorest adolescent girls and their families. Nankali provided us with examples from Cash Plus programming linking to government social protection programs in India, Ghana, and Zambia. And she presented some promising findings, but also emphasized the need for more evidence and evaluation on what works to reduce child marriage. Our presenters have reiterated the need for ongoing monitoring and surveillance, as well as experimental and evaluations around what works with respect to social protection to reduce child marriage. We've learned about a lot of exciting initiatives that are going on, and so we should keep watching this space. I think there's going to be a lot of new evidence coming out in the next couple of years. Our team is going to prepare a Q&A written document to be shared with the audience and to be published with the webinar summary, which will be available on socialprotection.org some days after this webinar. Remember that by joining the Social Protection Responses to COVID-19 Task Force online community, you can also participate in the follow-up discussions after the webinar. Remember to join the online community. The link is available in the chat. To keep updated about future webinars, engage in discussions and debates, contribute to the initiative, and have access to all materials related to the webinar, such as presentations, studies mentioned by panelists, and so on. So in conclusion, I would like to thank again our excellent panelists, our organizers, and particularly to you, the audience, for taking the time today and asking very engaging questions. Thank you to everyone, and have a great rest of your morning or your afternoon.